So the role of government. So Lena, do you want to take that section?
Sure. So federal and state government is currently deeply involved in healthcare. Its spending, regulations, and its tax code all play a large role in structuring the current market. Much of government involvement in the healthcare system comes from the Department of Health and Human Services, the HSS, which includes agencies such as the Centers for Medicare and Medicaid Services, the CMS, the Center for Disease Control and Prevention, the CDC, the Food and Drug Administration, the FDA, and the National Institutes of Health, the NIH. At the state level in particular, states provide health insurance coverage for their respective state employees. In terms of the ACA markets, 23 states have at least some control over the exchanges with either state-based, federally supported, or partnership exchanges. Of the $3.5 trillion spent on healthcare in 2017, the US government contributed about $1.5 trillion, mainly through Medicare, Medicaid, the Children's Health Insurance Program, CHIP. Medicare cost was about $600 billion, and Medicaid and CHIP cost just under $400 billion in 2017. Other spending by the federal government includes veterans and active duty military health care, as well as health insurance subsidies created by the ACA. Healthcare reform is on a top issue going in the 2020 election. Proponents of centrally planned government believe that the government should guarantee and subsidize universal coverage, consolidate providers into large organizations, and have experts manage federal spending in a way that drives efficiency throughout the healthcare system. Calls for Medicare for all, which would involve complete or majority control of the healthcare system by the government, have been making headlines in recent years. See more on Medicare for all this below. The free market advocates favor increasing competition to make insurance more affordable, so people will voluntarily buy it and introduce more market-based approach to consumption. They believe centralization does not improve efficacy, and that the government should take a more modest role and allow a functioning market to emerge. This creates a closer relationship between consumption and the payment of health services and empowers consumer within the market. The Department of Health and Human Services under the Trump administration released a report in December 2018 detailing efforts to reform the healthcare system by expanding choice and competition for American citizens, including effort that revises an ACA guideline to give states more leeway over their individual insurance markets. For more on the history of the role of government in healthcare, see this CMS report that we have in the brief.
All right. So do you have like some thoughts here about the role of government, given that you work in a clinic that's really independent and completely defined? I grew up in a system that's really centrally planned, and and I'm amazed here. I'm amazed here at the flexibility and the availability of care. Like you're not waiting long periods of time in Canada right now on any day. You have to go to the hospital for basic care where you have to wait 13 hours to see a doctor. You don't have a primary care doctor. You have to wait 18 months for a surgery. So there's that. I've experienced the centrally controlled, and so I see the value, and I see also the need for just flexibility and innovation that's amazing here. So I don't know, based on your experience also, and you work in a really unique clinic, maybe you have some thoughts about the role of government in healthcare.
Yeah, Sylvie, I'm conflicted. As you hear the central controlled government insurance versus, the free market, and there are elements of each of those are so appealing. And, obviously, when you have a centralized government, governmental insurance like they do in Canada, you see the pitfalls. And certainly when we kind of reflect on that free market, what kind of pitfalls there are there. I don't see one or the other exclusively on the extreme solving the problem. And that's where I feel conflicted with that. I think when you leave it, I think one of the things that makes the model of medicine that I'm practicing unique and provocative is that there is a local investment in it. It is not something that is farmed out to the free market. It's not something that's regulated by the government in the sense of it, that we take all individuals who do not have insurance or are using a health sharing thing, and it's supported by a small amount of money from our patients as well as private donations. So there are people volunteering their time. There's just a much more, not only a financial investment, but there's a physical investment. So I wonder how something more of that kind of new kind of innovative healthcare system where you locally, almost organically grown in the area of caring for those in need. So yeah. That's a unique model. So I know I wish I could say, oh, I think one over the other sounds better, but I really inherently see serious problems on each of these swings.
Yeah, it's kind of interesting also to think about healthcare in terms of something that you need to own as a community. Because you and I were discussing health disparities, and we realize a lot of your health outcome is driven by the care that's available to you. 20% of that, but there's 80% that's also about your environment, your education, your behavior, and that comes from your community. If you are in a community that values health, you see people running, there's great options for healthy food, you're surrounded with that idea of the health is an asset to your well-being and to the overall community, you will have better health outcomes. And I think that you bring this really interesting, thought-provoking, perspective about we need to own it in our neighborhoods almost. So